Hello everybody, we are here again with Ask the Vet. This time we will answer some questions about fungi. The main fungi problem in racing pigeons is named Candida. This is actually a yeast that can give problems in the throat. They can have a red throat, but also the intestines. And in a lot of cases it is caused by giving too much antibiotics. So when a lot of antibiotics are given, then the bacteria, the normal bacteria, are not present anymore in throat, crop, intestines, and when Candida is present, it can start to grow more and begin to cause inflammation problems. That is why sometimes it's good to treat for Candida. For example, amphotericin or nystatin are medications that can be used for this. So after an antibiotic treatment, it can be interesting to treat with that kind of medication. It can be found when there's a microscopic examination. And if there's a lot of problems with Candida, it is interesting to look at the system if there's not too much antibiotic usage. Okay, if you have other questions about this topic or other topics, please ask in the comment section. Thank you. Hello everybody, here we are again at Ask the Vet. This time we will address an issue important for racing itself, respiratory problems. You can speak about upper respiratory tract problems, so it means throat, nose, eye, and you can also talk about inner respiratory, so that's lungs and air sacs. The main problems for racing are upper respiratory problems. A lot of pigeons get some minor problems upper respiratory tract, and I believe that respiratory problems really give a problem for orientation, navigation capabilities. Not a lot, but enough to have a lesser result in the racing. Upper respiratory problems can be caused by several viruses, bacteria. There's a wide spectrum of, for example, chlamydia bacteria, mycoplasma, but also viruses like herpes, and probably there are more still unknown infectious agents that can cause upper respiratory tract problems. In a lot of cases, when you treat with antibiotics, you can heal the pigeon and clean the upper respiratory tract, and almost always after such treatment, the racing results are better. But if there's a lot of respiratory tract problems inside pigeons in a colony, it is advisable to also look at the loft construction, because if there's not enough ventilation on lofts, you easily get respiratory tract problems over and over and over again, and you always have to treat, which is not always that good. So if you have a good loft, sometimes you even don't need antibiotics to keep the respiratory tract clean. That are a bit of important things to look at. Which kind of antibiotics can be given? It depends also on the kind of bacteria. Chlamydia, for example, doxycycline is a very good treatment. Mycoplasma, then you can use lincocin, spectinomycin, spiramycin, tilozin. Those are all antibiotics that can be used to treat that. But in my opinion, you have to try to limit the antibiotic usage by also looking at loft construction also. If you have more questions about this topic or about other topics, don't hesitate to ask in the comments. Bye.